Hi everyone, I'm Dr. Amir Karam, board certified facial plastic surgeon and founder and creator of Karam MD Skin. I specialize in facial rejuvenation, which basically means I help people look as young as they feel. And today we're going to talk about a very important topic, a topic that I think a lot of you perhaps have been curious about, have been hearing about, and that is, can you reverse the damage that is caused by an overfilled face? And when I mean overfilled face, I'm specifically talking about faces that have either had products like Juvederm, Restylane, the hyaluronic acid category, Sculptra, Radiesse, and even in some cases silicone and even fat transfer. So when a face becomes overfilled in the quest to restore some volume, can those changes be reversed? And if so, what damages are going to linger? And these are very, very important things for you as a potential patient who's out there trying to defy aging and doing all the different things to slow down the aging process. I want you to know these things so that you can be prepared and prevent certain things from happening that you're going to regret later on. I think that's really the crux of empowerment, and the crux of this entire YouTube channel is helping you make good and informed decisions through knowledge. All right. We all know that there's a demand and an interest in the use of fillers. And the reason for that is somewhere around 20 years ago, and I was literally just getting going in my own practice and my fellowship, there was an increasing knowledge that the face loses volume with age. Before that, believe me, it was literally all surgical. You got a facelift, a brow lift, blepharoplasties, and that was it. This concept or this component of volume loss wasn't really hitting our awareness. In addition, we didn't even have any tools to really address it. Fat transfer was truly in its infancy. There's just a handful of people who were doing it, and fillers weren't even available. There literally wasn't. I mean, at that point, it was just collagen injections, which lasted just several months and were mostly used for the lips. So as a result of that, there wasn't a whole lot of demand or interest. And then gradually, as the products became available, awareness became available, an entire market opened up towards filling. Now, you have to go step back for a second and remember that the face has two parts of structural aging related to it. One is sagging. Those are all the things that cause jowling and neck laxity and the heaviness around the nasolabial folds and the heaviness in the corners of the eyes. That's related to the fascia elongating with age, just literally getting longer and longer. And then there's another component that's related to volume loss. That's where certain fat pads in the face, like the temples, around the eyes, around this part of the mouth, the lips, start to shrink a little bit. And so when that happens, and usually it happens in combination, although volume loss may start a little bit sooner in the process, generally speaking, the two are happening together. Sagging is happening as an independent mechanism, and volume loss is happening independently. But what has happened over the last 20 years is people begun to use fillers to try to solve the sagging problem. And it's kind of this paradigm or this visual that I'll show to you is like you see a full grape, and that's when your face is young, and then turns into a raisin as you get older. I know it's kind of a rough visual, but that's kind of the paradigm that was informing these decisions. And more fillers were coming out to the market promising terms like lifting and different things like that. So the non-surgical filler or liquid facelift concept came to life. And as a result of that, many people who are starting to see sagging were treating it with fillers of all different types, as I mentioned in the beginning of the video, all different types. And I published a video on Sculptra, so if you're curious what that is, check out that video, and lots of videos on fat transfer so you understand that. But the most common type of volume replacement that's done every day is the hyaluronic acid fillers. And those are the common brand names that you hear about, Juvederm and Restylane, etc. So the concept was your face is sagging, let's start putting filler in areas where you don't actually lose volume, areas in the cheeks, along the jawline, etc. And I did an entire video on how that process can actually aid you. And I think that is a really important video to watch in addition to this. But the concept is these fillers were told to us that they basically last 6 months to a year. And so people were getting onto a cycle of filling 6 months to a year in between treatments, sometimes even earlier. But what we've realized since then is that in fact, the fillers don't actually completely go away, that they leave a portion of them behind after every treatment, that their body isn't completely efficient in terms of breaking these fillers down. And as a result, you get this sort of base, you're increasing the volume base every 6 months to a year, building. Over time, what you end up getting is a face that looks grossly overfilled. And why do people let themselves get there? It's because you get used to the way things look, and therefore you feel that there's no more change. And if there's a little bit of a drop in the volume over a 6 month to a year period, you think, oh, you're back to baseline, which in fact you're not. You're just slightly less than you were 6 months ago. So it's this kind of like this type of a pattern where you're dipping a little bit, but you're going eventually higher and higher. And I did a video on Madonna, I've done videos on Courtney Cox, who shared a lot of her issues and concerns with the use of fillers, etc., and her own challenges. And we've discussed how in celebrity faces, sometimes we can learn some good lessons from their mistakes is when they share publicly about what's going on. So here's the question. Can you reverse this? Can these changes be reversed? And unfortunately, I see this every day in my surgical practice where patients come in now wanting to have my vertical restore or a facelift, etc. And sometimes those changes that have changed the face completely, you're stuck with. That's a hard truth, a hard pill to swallow, and it's an unfortunate reality, and it's one that's best avoided. Because what happens is there's a couple of things that occur that might make future decision making more difficult. Remember, at the end of the day, we all want to simply look as young as we feel, right? That's the reality of it. We want to look like we did when we were younger. We don't want to look like a different person. But what happens is when you start putting something that effectively creates a permanent type of a change, what you used to look like is no longer available. You're no longer going to have that appearance because the face has shifted in a different direction because of all the years of fillers in the wrong places. So what ends up happening is then you go in and you get a facelift, or if you come to my practice, you get a vertical restore, and you end up getting something that looks hopefully a lot better, but doesn't quite look exactly the same because now your cheeks are a lot fuller than they used to be. Maybe you have a new kind of heaviness along your jawline from jawline fillers, etc. And the damage that it causes into the tissues is in the way of scar tissue. So as a surgeon, I get into these faces all the time and I'm doing my normal deep plane dissection, etc. And people have had years and years of fillers, the tissues are sticky. And we've heard that over and over again. There's been lots of public awareness about this and surgeons discussing this and papers being published about it. And certainly we talk about it at our conferences all the time. But when you're doing these delicate operations, especially the deep plane, you rely on a very tactful and very smooth dissection in these spaces because there's some important structures like nerves and different things that are nearby. So you want to make sure that you're doing this in a very safe way. And when somebody's face is fully scarred in as a result of these fillers, well, it's unfortunate because it makes it much more difficult to do the procedure. Now, somebody like myself who does this day in and day out, I literally do 2 of these a day, most of the days of the week. What ends up happening is I'm used to that. I'm comfortable with it. I've been doing it for a long, long time. But you put your face in the hands of a surgeon who doesn't do them as often, hasn't had a whole lot of experience. Now those faces are going to be much more difficult to perform the procedure safely as well as effectively because if the surgeon uses good judgment, they probably don't want to push the envelope too far and risk some of these negative consequences from happening as a result of the damage that's been done to the tissues. In addition to making surgery more difficult, the tissues are no longer have the same, what we call tensile strength, the kind of like fabric of the face, the fascia. When you put sutures through them, a lot of times because of the chronic inflammation caused by these fillers, a lot of surgeons have this experience that the sutures that you put through almost cheese grate right through. They don't have the firmness that can hold the stuff in there, especially for people who've done this for years and years. So, long story short, those are the consequences surgically that might see. The aesthetic, physical consequences of the changes in shape, like a big full cheek, big lips, etc., long, heavy jawline that don't necessarily resemble what you used to look like. And unfortunately, even with hyaluronic acid fillers, the fillers that are supposed to be dissolvable, you can't really dissolve them all the way because if you start to to try to do that, you're going to get this waviness and lumpy bumpy throughout the face because it's nearly impossible to make sure you get every aspect of the filler completely dissolved. Additionally, the fillers like Sculptra and Radiesse and silicone and fat transfer, those are much more durable, and they don't have a way of putting an enzyme, for example, and even dissecting portions of it. You're kind of stuck with some of those things for a very long time, or in many cases permanently. So you got to be very careful, very wary. This is the time that we start to really understand that just because we thought something at one point, and we're all guilty of it, we're all, all of us in the industry have, sort of drank the Kool-Aid, if you will, of thinking that this is an approach that might be meaningful. But I think that now is the time, after reflecting on 15, 20 years worth of data, clinical experience, etc., we all kind of know, realistically, that not only did it not really help do an anti-aging method, didn't really help make somebody look younger, but there's consequences to long-term use. And the reality of it is that these changes that happen to the tissues, even if they're moderately used, are fundamentally permanent, and there's no way to reverse scar tissue. There's no way to remove filler that has been transferred into the way of scar. That's the other thing that happens. Chronic inflammation lays down scar tissue, as I mentioned, so you can't really reverse scar tissue. So some of these changes truly are more or less permanent. The damage is long-term. So try to keep all this in mind as you make good decisions for yourself. We need to make solid decisions going forward. Fillers should not be placed in areas that don't lose volume, like the cheeks, the jawline, etc. Be very, very mindful of this. If you're in that kind of quest to avoid surgery, believe me, you're not going to get there with this type of an approach, so stop it. If you have friends, family who are considering this type of stuff, share this video, let them, make some solid decisions, or at least be informed, and certainly take this notion to their own injectors and their own doctors and see if they agree with me and if this makes sense, etc. But I feel strongly about this, and again, like I said, lots and lots of experience to support it, as well as conversations with many colleagues who are now very, very passionate about this particular issue. So folks, if you enjoyed this video and enjoy this type of topic, hit subscribe so you can get this video once a week, hit notifications so you're aware of it. Share this with friends and family. If you have any questions or comments below, drop them in the comments. We'll make sure we answer as many of them as absolutely possible. And once again, thank you so much, Dr. Amir Karam.